Moving on to the next question. My aunt suddenly had a severe headache and collapsed. The doctors say she has a ruptured brain aneurysm. What caused this and what are her chances of recovery?
So, an aneurysm is a weak area on a blood vessel that goes to the brain in this case. Think of it like a soap bubble. So think of it like sometimes if you've seen old cycle tires where the rubber has worn out and some of the inner tube is poking out like a little balloon, that is basically an aneurysm of the brain. And people are usually born with it. And as they get older, it slowly gets bigger. And the biggest risk of it is bleeding, because remember, blood is passing through this. And if the wall of the aneurysm becomes very thin, it can bleed. And that's a very serious thing because, again, there is no screening test for this condition. And many patients who present with it come in because for the first time they have this severe headache and some of them just become unconscious. And when you do a CAT scan, they've got a lot of blood in the head. And when you do other studies known as angiograms, it shows you the aneurysm.
Mhm.
And then
Mhm.
the treatment of aneurysms now has advanced very, very well. Several years ago, the only way to treat them was with open surgery. But now they have a treatment known as endovascular treatment, which is similar to people getting cardiac catheterization. You can have brain catheterization, and they're able to put glue or wires into the aneurysm to clot it off and prevent it from bleeding again. So there have been a lot of advances in the management of brain aneurysms over the last couple of decades.
And what would you say are the risks of brain aneurysm surgery, doctor?
The risks are pretty much the same, excuse me, the same as for any brain surgery, which is bleeding, stroke, infection.
Mhm. Mhm. And can brain aneurysms be treated without surgery, doctor?
Yes, as I mentioned, they can be treated with uh, putting balloons in them or putting wires in them by going through the blood vessel, which completely avoids surgery and is very effective. And I would say that probably 80% of all aneurysms now are treated that way.
And what are the long-term effects of having a brain aneurysm, doctor?
It all depends whether it's been caught before it bleeds or after it bleeds. If it's caught before it bleeds, uh, patients can often be completely asymptomatic after their treatment. On the other hand, if it has bled, a lot depends on how sick they got because of the bleed and if they get because the almost 50% of patients who have an aneurysm that bleeds can often just die on the spot. So it's a very serious thing. And so those that survive and they come to hospital and they get their treatments, it a lot depends on how bad that initial bleed was. If it was a mild bleed, they can have an excellent recovery. If it was a severe bleed, they can be left with problems like weakness, numbness, psychological issues, memory issues, that kind of thing.
Mhm. And how can you prevent a brain aneurysm from rupturing, doctor?
So the general measures are things like if people have high blood pressure, they should keep their blood pressure under good control. But other than that, the only other way to prevent it from bleeding is to block it, either using the balloons or the wires or with surgery.
Mhm. Thank you so much for your insights, doctor. And I, for one, am loving the analogies. Thank you.